One is a cold, calculated predator hiding in plain sight. The other, a volatile and impulsive force of chaos. One is often described as being born with a brain that processes the world without emotion. The other is forged in the fires of a traumatic environment. Both walk among us. They can be our colleagues, our neighbors, and in some unfortunate cases, the people closest to us. They operate on a different frequency, following an internal script that sets them apart from the rest of humanity. So, what really are the differences between a psychopath and a sociopath, and how can you learn to spot them? In the vast and often unsettling landscape of human psychology, few terms are as popular and as profoundly misunderstood as psychopath and sociopath. We see them in movies, the charming, brilliant killer who's always 2 steps ahead, or the hot-headed gangster who explodes at the slightest provocation. We hear the terms used in news reports and true crime documentaries. But these portrayals, while dramatic, only scratch the surface of a complex and chilling reality. Understanding the true nature of these personalities isn't just for morbid curiosity. It's about safety. It's about recognizing the subtle signs of manipulation, the unnerving lack of empathy, and the patterns of behavior that can cause immense harm. This knowledge empowers you, allowing you to navigate the social world with a clearer understanding of the psychological currents flowing just beneath the surface. Here, we're going to deconstruct the internal wiring of both the psychopath and the sociopath. We'll explore their origins, how they think, how they feel, or don't feel, and how their inner worlds shape their destructive actions. By the end, you'll have a clear, nuanced framework for telling them apart, understanding their overlaps, and seeing them for who they truly are. The diagnostic dilemma. Are they real diagnoses? Before we get into the differences, we have to start with a crucial and often surprising clarification. If you were to open the latest edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5-TR, which is the official guidebook for mental health professionals, you wouldn't find a clinical diagnosis for psychopath or sociopath. These are not formal medical diagnoses a person can receive. So why do we use these terms? And what is the actual diagnosis that covers these behaviors? The official diagnosis that encompasses these traits is called antisocial personality disorder, or ASPD, according to the DSM-5-TR. ASPD is defined by a pervasive pattern of disregard for and violation of the rights of others, starting in youth and continuing into adulthood. The criteria focused heavily on observable behaviors. Things like a failure to conform to social norms, deceitfulness for personal profit or pleasure, impulsivity, irritability, and aggressiveness, a reckless disregard for safety, consistent irresponsibility, and a profound lack of remorse. To be diagnosed, a person must be at least 18 and have shown evidence of a related condition, conduct disorder, before age 15. Think of a SPD as the large, clinical umbrella. Psychopathy and sociopathy are best understood as 2 different constructs that fall under this umbrella. Sociopathy is an informal term, not officially recognized as a distinct clinical subtype in diagnostic manuals. It's often used colloquially and theoretically to describe antisocial behavior that's seen as a product of environmental factors. The core idea is that a sociopath is made their condition is viewed as the result of severe childhood trauma, neglect, or a chaotic upbringing that damages their moral and emotional development. Psychopathy, on the other hand, is a more specific and heavily researched construct, often considered a more severe subset of ASPD, while it includes the same antisocial behaviors. Its definition places a much heavier emphasis on a unique set of personality traits, particularly emotional deficits like a profound lack of empathy, shallow emotions, manipulativeness, and a glib, superficial charm. To assess these specific traits in forensic and research settings, clinicians often use a specialized tool called the Hare Psychopathy Checklist Revised, ORPCLR. This 20-item checklist is the gold standard for assessing psychopathy. Factor 1 of the checklist measures the selfish, callous, and remorseless use of others, the core emotional traits. Factor 2 measures the socially deviant lifestyle, like impulsivity and poor behavioral controls. While a person can have a SPD without scoring high on the PCLR, Most people identified as psychopaths do meet the criteria for ASPD. This has led many experts to view psychopathy as the most severe and dangerous form of antisocial personality disorder. The blueprint of origin: nature versus nurture. If a psychopath is a cold predator and a sociopath is a volatile force of chaos, where do these paths begin? The answer leads us to the classic debate of nature versus nurture. The reality is always a complex mix of both. But the distinction between psychopathy and sociopathy often leans on this very question. Let's start with the psychopath. The prevailing theory has long been that psychopathy is largely a matter of nature, that psychopaths are essentially born with a brain that's wired differently. Research using neuroimaging has revealed significant abnormalities in brain regions related to emotion, fear, and decision-making, like the amygdala and prefrontal cortex. This isn't just about personality. It's about different biological hardware that can result in a profound inability to process emotions, especially fear. They can learn the social rules, observing how others react, and mimicking emotions like remorse, but they are often incapable of genuinely feeling them. Now, let's turn to the sociopath. The blueprint for sociopathy is more commonly linked to nurture. While genetics might play a role, sociopathy is primarily seen as the result of severe environmental trauma during critical developmental years. Things like extreme abuse, neglect, or constant exposure to violence. Unlike the psychopath, who may have been born with a deficient emotional system, the sociopath's emotional development is violently disrupted. Their capacity for empathy and attachment may have been burned out of them by their environment. However, it's crucial to understand this nature-nurture divide is not a clean split. It's more of a framework for understanding the primary drivers. Current research shows that both genetic predispositions and environmental factors contribute to both conditions. Think of it as an interplay. A child with a genetic vulnerability to psychopathy might not develop into a full-blown psychopath if raised in a stable, nurturing environment. Conversely, a child without that genetic marker could still develop sociopathic traits if subjected to severe trauma. So, it's less about being just born or just made, and more about a destructive combination of the two. The emotional landscape: a barren desert versus a raging storm. Imagine trying to navigate the world without the compass of emotion. No genuine joy, no crippling sadness, no pangs of guilt, no warmth of love. This is the inner world of the psychopath, an emotional landscape that can be described as a barren, silent desert. The defining emotional trait of psychopathy is a shallow affect, a severely limited capacity to experience emotion. It's a fundamental disconnect from the entire spectrum of human feeling. The well-known lack of empathy is a direct result. A psychopath can witness suffering and feel nothing more than detached curiosity, or perhaps even a flicker of power. This emotional void is also why they are incapable of genuine remorse or guilt. Any apology is a calculated performance, designed to regain trust for future manipulation. Their calmness under pressure, often mistaken for courage, is simply a reflection of their inability to process fear or anxiety. Now, contrast this with the emotional landscape of the sociopath, a raging, unpredictable storm. Unlike the psychopath, the sociopath isn't necessarily devoid of emotion. In fact, they can be intensely emotional, but their feelings are volatile, reactive, and poorly controlled. Their world is often dominated by anger, rage, and hostility, because their antisocial behavior is often rooted in trauma. They are quick to perceive threats and insults, leading to the hot-headed behavior they're known for. They are prone to sudden, explosive outbursts that seem completely disproportionate to the situation, making them far more erratic and unpredictable than the calculating psychopath. So, the emotional distinction is one of the clearest ways to tell them apart. The psychopath is defined by a profound lack of emotion, a cold, empty desert. The sociopath is defined by a profound dysregulation of emotion, a hot, raging storm. The art of deception, the mask of sanity. Both psychopaths and sociopaths are fundamentally deceitful. It's a core feature of ASPD, but how they deceive, and how well they do it, reveals another critical difference. This is best understood through the concept of the mask of sanity, a term from psychiatrist Hervé Cleckley to describe the psychopath's uncanny ability to appear normal, even charming. The psychopath is the master of this mask. Unburdened by guilt or anxiety, they can lie with a calmness and conviction that is incredibly persuasive. Their superficial charm is a key part of this mask. They are often witty and engaging, able to quickly read people and tell them exactly what they want to hear. This charm isn't genuine warmth. It's a finely honed tool of manipulation. Their behavior is calculated and strategic. They will patiently build trust, creating a detailed illusion of a caring person, all in service of a long-term goal. This is the snake in the suit who can climb to the highest ranks of power before anyone realizes the truth. The sociopath, however, struggles to maintain such a sophisticated mask. Their impulsivity and emotional volatility often cause it to slip. While they are also manipulative, their methods are often cruder. Their lies may be more transparent, and their attempts at charm can quickly give way to hostility. A sociopath's manipulation is less about a long con and more about short-term, impulsive gains. They lack the psychopath's patience and self-control to maintain the facade over time. Their history is often a chaotic trail of burned bridges, a direct result of their inability to stop lashing out. Imagine both are passed over for a promotion. The psychopath might smile, congratulate the winner, and then spend months subtly sabotaging their new boss, spreading believable lies and manipulating situations to make their rival look incompetent. It's a slow, devastatingly effective game of chess. The sociopath is far more likely to have an immediate, explosive reaction storming into an office, sending an aggressive email, or publicly badmouthing the person who got the job. Their actions are impulsive, emotionally driven, and ultimately self-destructive. The web of relationships, illusions versus dysfunctional bonds. It is in the realm of human connection that the difference between psychopaths and sociopaths becomes tragically clear. For the psychopath, a genuine, reciprocal emotional relationship is an impossibility. Because they lack empathy and the capacity for love, their relationships are entirely transactional. People are objects, tools, or pawns to be used for personal gain, like money, status, or entertainment. A psychopath may marry, have children, and keep friends, and from the outside, it can look perfectly normal. They'll say "I love you" and perform all the right actions, but it's an act. While they are incapable of forming genuine emotional bonds, some research suggests they may form superficial or instrumental attachments, designed solely for personal gain. Once a person is no longer useful, the psychopath discards them with a coldness that is shocking to witness. Incapable of understanding the pain they've caused. The sociopath's approach to relationships is different. It's not an empty illusion, but it is deeply dysfunctional and chaotic. While forming stable relationships is extremely difficult for them, it's believed that sociopaths can sometimes form genuine, albeit warped and unstable, attachments. Unlike the psychopath's emotional void, the sociopath's capacity for connection was more likely damaged by their environment. They may feel a form of loyalty or affection, often towards a small group of people. However, these bonds are almost always turbulent. A relationship with a sociopath is a roller coaster of intensity and chaos, punctuated by explosive arguments, manipulation, and even violence. Their attachments are colored by their own internal storm of anger and paranoia. So, while a psychopath creates a perfect, hollow illusion of a relationship, a sociopath might engage in a real, but hopelessly dysfunctional, bond. The psychopath is incapable of true attachment. They treat people as objects. The sociopath may be capable of a limited, chaotic attachment, but their emotional instability ultimately poisons the connection. The criminal mind, predator versus brawler. Both psychopathy and sociopathy are strongly linked to criminal behavior. But just as their emotional styles differ, so do their patterns of crime. The distinction can be summarized as the calculated predator versus the impulsive brawler. The psychopath, when they turn to crime, is often the more dangerous of the two, precisely because of their lack of emotion and meticulous planning. Their criminal behavior is often proactive and instrumental, a calculated means to an end. This is the white-collar criminal who masterminds a complex fraud scheme, or the organized serial killer who plans their crimes with chilling precision. Because they don't feel fear or anxiety, they can execute their plans with a steady hand. The PCLR is one of the strongest predictors of future violence and reoffending. Research suggests that after release from prison, psychopaths are approximately 4 times more likely to violently reoffend than non-psychopaths. The sociopath's criminal activity, by contrast, is typically impulsive, disorganized, and reactive. They are far more likely to commit crimes of passion or opportunity, a bar fight that turns deadly, a sudden shoplifting impulse, an assault during a fit of rage. They lack the psychopath's patience to plan complex crimes. Their actions are often sloppy, leaving behind plenty of evidence, which is why they tend to get caught more easily. This doesn't make them any less dangerous in the moment, but their overall criminal career tends to be more chaotic and less successful. The unspoken similarities where the paths overlap while we focused on the differences. It's just as important to see where the paths of psychopathy and sociopathy converge. They share a dark core of traits that lands them both under the umbrella of antisocial personality disorder. The most fundamental similarity is a pervasive pattern of disregarding and violating the rights of others. Both navigate the world with a profound sense of entitlement, believing their own desires supersede social rules and the well-being of others. Another critical overlap is a profound lack of remorse. Whether it stems from a psychopath's innate inability to feel guilt or a sociopath's rationalizations, the end result is the same. They don't feel bad about the harm they cause. Deceitfulness and manipulation are also common to both. Whether it's the psychopath's sophisticated charm or the sociopath's cruder lies, both use deception as a primary tool to get what they want. They see other people not as equals, but as resources to be exploited. Both are also characterized by irresponsibility and a failure to learn from consequences. They may have unstable employment, be financially reckless, and fail to honor obligations. Even when their actions lead to arrest or broken relationships, they tend to blame others, the system, or bad luck, and are therefore likely to repeat the same mistakes. Finally, both are associated with a higher risk of aggression and violence. Whether it's the cold, predatory violence of the psychopath or the hot, reactive violence of the sociopath, the potential to cause physical harm is a significant concern for both. The question of change: can they be fixed? After exploring the destructive nature of these personalities, the big question is, can they change? Can a psychopath or a sociopath be fixed with therapy? The answer, unfortunately, is complex and largely pessimistic, especially for psychopathy. Treating psychopathy is notoriously difficult and, in some cases, can even be counterproductive. The very traits that define it, the lack of empathy, the inability to form a therapeutic bond, the manipulativeness, make traditional talk therapy ineffective. Some studies have alarmingly found that certain therapy programs may actually make psychopaths worse by teaching them more about emotions from an intellectual standpoint, allowing them to hone their mask of sanity and become even better predators. However, while the outlook is bleak, some recent research suggests that certain highly structured interventions may have limited benefits for some individuals, though this is far from a cure. The outlook for treating sociopathy is slightly more hopeful, though still incredibly challenging, because it's often rooted in trauma and emotional dysregulation. Therapies that focus on anger management, impulse control, and processing past trauma can sometimes be effective. Unlike the psychopath, the sociopath may have a flicker of desire for connection, which can sometimes provide a small foothold for a therapist. Still, challenges like mistrust and manipulation are ever present, and relapse rates are high. The hard truth is that there is no cure for antisocial personality disorder, however it manifests. These are deeply ingrained, lifelong patterns. While treatment can sometimes manage the most dangerous behaviors, particularly with sociopathy, core personality structure is unlikely to fundamentally change. Early intervention in childhood offers the best chance of altering these destructive paths. For adults, the goal often shifts from rehabilitation to management and containment, protecting society from individuals who may be incapable of ever truly changing. We've explored the inner workings of two of psychology's most troubling figures. We've seen the psychopath as the cold predator, often described as born with a brain incapable of empathy, wearing a mask of sanity to manipulate the world. They are seen as a product of nature. In contrast, the sociopath is the volatile force of chaos, often forged by trauma, whose emotional storm makes them erratically dangerous. They are seen as a product of nurture. We've distinguished the psychopath's emotional desert from the sociopath's raging storm. We've compared their different approaches to crime and deception. Yet, we've also seen where they converge, in a shared disregard for others, a lack of remorse, and a trail of destruction. Understanding this isn't just an academic exercise. It's a vital tool for psychological literacy. It helps us see past a charming facade, recognize the red flags of manipulation, and protect ourselves from those who operate by a different, darker set of rules. It reminds us that the most dangerous people don't always look like monsters. Sometimes they look just like us. If you found this look into the human mind valuable, please give this video a like. It helps more people discover this important information. For more content that decodes the complexities of human psychology, make sure you subscribe and hit the notification bell. And if you're curious to learn more about manipulative personalities, check out our video on the 5 hidden signs of a narcissist right here. Thank you for watching. Stay aware and stay safe.